Facebook group. And what I was going to do is just go over a couple of things. I think everyone's muted, so if you have any questions, I would ask that you put them into the chat box and also raise your hand. But what we'll do is we'll go through just a bit of an introduction first, and then we're going to hand over to Alison and Charlie, who are going to talk a little bit more around the quarter equina injury Facebook group. One of the things just to bear in mind is we've had quite an influx of people wanting to come along to this session. So what we've had to do is, a lot of people couldn't make it, so we're going to have to record the session. So it's just to let everyone know that this is being recorded. So if you don't want to be seen, then please just blank your face out. And as I say, any questions we'll go over, and so Sophie will pick them up. And what we're hoping is if you get your questions in now, well, a lot of them might be the same questions, so we'll be able to narrow them down and try and answer as many as possible in this session. Just to give you an idea on the lineup and who's going to be with us today. So we are joined with husband and wife partner Alison and Nigel and Charlie, and we're going to have Damien on SIA nurse specialist is going to be there to answer questions. And we also should have Lindsay from the Aspire charity just to talk a little bit about what they offer in their services. And also we're going to have, or rather should I say, last but not least, our very own Dan Burden, who is head of advocacy and campaigns, who's actually going to be the first one to take the stand and talk about the if anyone's aware of the SEI UK, so the Quarter Equina Syndrome UK national charity and the partnership with SIA, and he's going to do a little talk about that now. So without further ado, I shall hand over to Mr. Dan Burden.
Thank you, Carl. And hello, everyone. As Carl says, I'm Dan Burden. I'm the head of advocacy and campaigns at SIA. And I just wanted to take a moment to say that we're very pleased that Quarter Equina Syndrome UK is joining forces with SIA. As some of you probably know, Quarter Equina Syndrome UK was set up as a charity in 2012 to serve and support people who develop a spinal cord injury as a result of quarter equina syndrome. CES UK approached us to become part of our association at the end of last year, so it could ensure its members would have both bespoke support and information from Quarter Equina Syndrome UK, as well as access to all of SIA's programs such as our specialist clinical support, training, advocacy and representation, counselling, and mental health and wellbeing services. We all agree that this was a groundbreaking opportunity. Our aim as a charity, SIA that is, has always been to ensure that every person who lives with the effects of damage to their spinal cord, whatever their cause of injury, has the opportunity to live a fulfilled life. And hopefully by welcoming CES UK into the association, more people will be able to use the end-to-end services of both of our charities. So just a little explanation of how we're hoping this is going to develop. We're planning to run CES UK from its own office in Leicestershire with bespoke services for CS people such as peer support, specialist advice, as well as linking members in with SIA's network of services and partners where appropriate. You're going to be hearing from some of our services later and some of the organisations in our network. If this is something that you would like to be a part of, then SIA is currently recruiting for paid roles across the country and would love to hear from you, especially if you live in the East Midlands. But if you're interested and you don't live in the East Midlands, please get in touch. We'd also love to hear from anyone who would be interested in volunteering or working with us in some ways. There's more information available on SIA's website, which is www.spinal.co.uk. But I'll also add links to the job roles and the volunteering in the chat. So thanks very much. I hope you all enjoy the rest of the cafe, and back to you, Carl.
Thank you very much, Dan. Actually, I've actually just realised I didn't actually introduce myself. So my name's Carl Martin, and I'm actually part of the support network team at SIA. And my role is I cover the Southeast. And as Dan was saying, you know, we are looking to recruit. There are some opportunities to recruit other people within different locations. But yeah, like I said, I'm part of that team, and we're here to support you in any way. and you can find our details on our website. If there's anything you want to ask after the cafe, then please, like I say, find your way to our website and send me an email, and I'll do what I can, or anyone in your particular area, to support you. Hopefully, I can't see her, but we've got Lindsay with us from Aspire. I don't know if she's with us yet. If not, I'll chase her up now, just because I think she was having problems getting on. So what I'll do now is I'll pass you over to Damien, who's going to talk a little bit about the SIA Nurse Specialist Services and what they provide. Over to you, Damien.
Okay, thank you very much. I'll give it a go. I'm the new boy in SIA. So I only joined back in November. Prior to that, I was working as a clinical nurse specialist at the Spinal unit in Salisbury, where I've been working for the past 25 years. And I've actually spent 30 years in the NHS. So you're all wondering, crikey, he's been there for ages, but I only joined when I was 7, so I'm still quite young. But what I was doing at the Spinal unit, or part of my role, was to run the Cordra Equina clinic. The spinal centres, they all have their own, they all have their own criteria as far as who would get access to a spinal centre. So, unfortunately, not everybody with a spinal cord injury would get access to a spinal centre. Not everybody with Cordra Equina would get access either. And one of the things that we try to do in SIA is support the 2/3 of people that don't get access to a spinal centre. So we've always supported people with Cordra Equina, but I think the merger has just really sort of reinforced that there is a greater need to do that. Carl's already mentioned that there's lots of information about our services on our website. We are keeping the Cordra Equina website as a separate entity. Although we will look at that and just make sure that it's kept updated in the same way that the SIA website is. So although there's 2 websites essentially, all the support services you'll find on the Spinal Injuries Association website, and that includes things like advocacy, campaigning, the Spinal Cord Injury Nurse Specialist service, which I'm part of, and there are 4 of us that cover the whole of the whole of the UK. We don't cover Scotland because Scotland has their own sort of branch of the Spinal Injuries Association, if you like. But we certainly cover England, Wales, and Northern Ireland. And for me, primarily, I cover the southwest, and the southern counties of Wales. We also do a lot of teaching, a lot of education, and we will be incorporating that to include Cordra Equina as well. I've just today found out that a colostomy fact sheet that I'd written for spinal cord injury and Cordra Equina has just gone onto our website. So when I wrote it, I very much had in mind the Cordra Equina group as well. Just so that people are aware that that's another option when it comes to sort of dealing with some of the challenges that you may face. I've also been sort of tasked with developing a nursing assessment specifically for Cordra Equina as well. So we already have one for paraplegia, and we already have one for tetraplegia. So it makes sense that we do have one for Cordra Equina as well. So it's great to see so many people here today, because I might well be picking some of your brains, because I don't want it to be a piece of work that I've just put together myself based on my knowledge of Cordra Equina. It'd be good to have like a user's perspective of it as well. So yeah, I will be contacting some of you just to cast your eyes over it when I have got it in draft form. So this really is very much your opportunity just to ask questions to us, and I'll introduce you to Charlie and Alison and Nigel, and then we've got Heidi here as well from the Facebook group. So I think it's probably a good opportunity for me to stop, have a sip of my tea, and I don't know who wants to go first, Charlie, Alison, or both of you.
Alison, should I go first, or do you want to go first?
No, Charlie first.
No, you go first.
Well, hang on, before you do that, it'd be really good just to, just hear a little bit about, how the group and just, what you hope to do, sort of within the group, because possibly, a lot of the people here are already members of the group, but for those that aren't, it'd be a good opportunity just to hear, what they could possibly get out of, joining the group with you.
And also, if I could just add to that, what would be quite nice, and now I am going to hedge my bets here and talk about post-lockdown. I know it's a big thing to think about now, but to hear from you guys about where you see yourself going over the next, how you're going to evolve over the next sort of 12, 24 months as well.
Okay, so if Charlie starts.
So the question is how are we going to evolve after lockdown? And I would imagine we are going to be evolving by doing more support groups, as in meeting people outside and kind of cafe afternoons, stuff like that, Alison?
Yes, yeah. Go meeting up for coffees and just getting together and having groups that will hopefully get some specialist speakers there, like Damien, SIA, and other people with the expertise to help answer some questions. But mainly it's about getting to meet fellow CES friends, members.
Definitely.
Yeah.
So that's probably going to be after lockdown.
Because sorry to interrupt. Can I just ask as well, just for those that don't know you, you're at quite different ends of the country as well. Charlie and Alison.
I'm up in the snowy part of the UK. I'm up in the north of the UK. And how I met Alison, there was just through loads and loads of research. I met Alison and Nigel through the Codra community. And that's how I got to know them. And I had a road trip last August. I took my partner down to see Alison and Nigel, and we kind of came together that way. And we just thought, wouldn't it be a great idea if we could put our heads together and come up with a Facebook group that would, it could spread awareness and befriend other Cauda equina patients.
Exactly. So we're bringing this, the aims of our group is to bring the CES community together. We think we're a very positive and proactive group. We like to listen and to support everyone, the best way we can, and make friends with each other. And it's the fact that other CES friends become friends, because a lot of people find they lose friends from having this condition. And it's to get CES recognised as a spinal cord injury, and SIA's allowed us to collaborate with them and offering us our services that they provide, which gives CES recognition what it deserves. Thank you very much.
Yeah, definitely. I could have said it better.
So, my aim is just to basically support, listen, and be there for other CES members to say we're not alone.
And that's fantastic. And I think, it's really important that, people that do have, Cauda equina feel that there's, somewhere that they can go to that they can feel quite at ease just to talk about, some of the more personal issues that they might be facing, with people that have that same level of understanding. Because, I've often thought myself that I have 25 years of spinal cord injury nursing experience, but I have no experience of, what living with a spinal cord injury actually means, other than just, sharing the experiences that, I've been privileged to hear, through patients that I've looked after. So, I can really see, the benefits of, how somebody with cauda equina or spinal cord injury, what they can get out of, talking to somebody that's in the same situation as them. I can provide, medical advice. That's not a problem. But sometimes it's not the medical advice that is always what's required. It's just having a chat to somebody and saying, you know what, I feel rubbish today, and my pain's driving me nuts, or some of the other sort of physical side of cauda equina that Joe Public may not have an awareness of, but when you've got the security of talking about these issues within a group of like-minded people, it's not necessarily to try and give medical advice. It's just an ear to listen to somebody that's going through the same things that you've possibly gone through, and maybe just sharing that experience of perhaps what you've been able to do to try and deal with some of these challenges.
Exactly. You seem to have a knowledge on it.
Right, I'm just going to have a quick look through the chat box we started.
While we're having a look, so I was going to say we have got quite a few questions coming in, which I think some will be really good for Damien to answer. So I'll let Damien have a read of them, so you can come. Apologies. So you can come back with an answer to those. But in the meantime, I was just wondering if I know Lindsay's on here now from Aspire, so I was wondering if she would just like to have a quick talk about their services while we're here. So I'll hand over to you, Lindsay.
Hello, can everybody hear me?
Yes.
Yes. Hi, Lindsay.
So I'm Lindsay. I'm the Independent Living Advisor in Stanmore. I work for Aspire, which is the national charity, and we support people with spinal cord injury. Aspire's got various different services. We do have the Independent Living Advising service, which means that we have independent living advisors in all of the spinal units. So if you are lucky enough to go into a spinal unit, please speak to one of the independent living advisors, because they've got a wealth of knowledge. We've all got spinal injury, so tap into that service, please. We also have the welfare benefits team that specialises in helping people with benefits claims. I can't stress enough, if you've got a benefits claim, please speak to somebody who's got experience with these forms, because they are designed to trip you up. So if you have a look on Aspire's website, they've got all the information on there, and there's the contact details to be able to contact the welfare benefits team. We also have Money Matters team, and they can help you with what you're entitled to. Again, details are on the website, so you can have a look on the website for that. And we also have a housing benefits team. So if you need help with accessible housing, there's advisors that can help you with that. And we also have various accessible properties dotted around the UK. So if you need temporary accommodation, they can maybe, if they're available, they can help you with that. So again, that's on the website. So if you can, register please with Aspire, because we've then got all of your information. If you need any of our services, we can just tap straight into your information and help you. And we also send out newsletters, so we'll be able to give you all the information through newsletters. And that's really it for me. I'll pass you back over to Paul.
Thank you, Lindsay. Thank you very much. I don't know, Damien, if you had enough time to have a look. Like I say, we've had quite a few questions come in. I think there was a couple I managed to pick up, and a little bit was around and I know with cauda equina, it's the initial phase is very difficult to diagnose, and I think sometimes it's the fact that it goes undiagnosed, and then it's the awkwardness of trying to get to potentially a spinal centre, Damien. So I don't know if you've got any advice around how to go about getting referred.
So the referral criteria for spinal centres is, when I say quite rigid, there is quite distinct admission criteria. And just to give you an example, like I say, 2/3 of people with a spinal cord injury or cord recliner never make it to a spinal centre. There are certain conditions that would mean that they don't meet the criteria. So, for example, somebody that's undergoing chemotherapy for cancer, cancer can be a cause of spinal cord injury or cord recliner. The spinal units, they're not particularly geared up to be able to manage that side of the medical condition. So somebody with cancer treatment, they're generally better off on an oncology unit where that can be managed more effectively. But we do recognize that there's still the needs of the cord recliner, the spinal cord injury, that need addressing as well. So if it's not down to the spinal units to be able to manage that, then that's somewhere where SIA can step in. As far as the actual criteria, when I say I can only speak for Salisbury Spinal Unit, I think it's a nationally agreed sort of pathway. When it comes to cord recliner, the people that would be accepted under the care of the spinal unit would be people that have bladder and bowel dysfunction. If there's no bladder and bowel dysfunction, that person would probably not meet the criteria for admission or the support services of a spinal centre. I think one thing that SIA is quite keen to do is to try and address these issues that we're aware that I don't know what the capacity is off the top of my head of all the spinal centres in the UK, but if we know that 2/3 of people never make it to a spinal centre, essentially we've got 11 spinal units in the UK, so we would need 33 to accommodate everybody's needs. I'm not suggesting that that's a pipe dream, but that might be something that over time SIA can support the sort of demand for that. I'm sort of not waffling on, but I'm just wondering whether I have actually answered the question with regards to why people with cord recliner, how to get people with cord recliner into a spinal unit. So I guess the first thing is, if there is any sort of bladder and bowel dysfunction, then that's pretty much a tick to say yes, you would meet the criteria for referral. Then as far as the referral process, if you're at home, the GP can make that referral. If you're in hospital, the medical staff can make that referral. It's a nationally agreed referral process. So in hospitals, there's an online form. If you're at home, it's just a simple letter from the GP to the spinal consultants. Once they receive that referral, then so long as there's a clear diagnosis, then they would make the decision as to whether you meet the criteria or not. For those that don't, then there are organisations like the Spinal Injuries Association that can provide that sort of, I say medical advice. It is medical advice, but it's coming from a nursing perspective. So I'm one of 4 nurse specialists. We're not doctors, but between the 4 of us, we've got over 100 years of spinal cord injury and neurological experience. So I'd be confident in the fact that we can at least give you good advice, or if we don't know the answers, we can signpost you to other more specialist services. Because even the spinal units, they're not the sort of panacea as far as managing the whole condition. The spinal units work very closely with other specialities like urologists and neurologists, general surgeons, a variety of different specialities. So I think, part of my job when I worked for Salisbury Spinal Unit was almost just signposting people to the right organisations or the right specialities. So that's the referral process in a nutshell. it can be done by the GP, but we do need to have that clear diagnosis of what your cord requiner, what that actually means for you. And it would be the bladder and bowel involvement. Otherwise, outside of that, then, there are neuro rehab centres which deal with a much broader range of conditions. There are neurophysiotherapists as well that have more of a understanding about, the sort of neurological conditions when it comes to mobility. So I hope that's given you a bit of an idea of how that referral process works.
And with regards to the private rehab side of things, what I would say is, as a charity, we're really working on building our partnerships with various rehab centres in different regions of the country. So I would again say, get in touch with us, because I'm sure that we'd be able to assist with potentially finding a local rehab centre to you for ongoing support. I've actually had a question from Lydia come in for you, Damien, and it's just around, have your patients had much success with pelvic floor nerve?
Oh, the simple and honest answer is I don't know the answer to that question, unfortunately. It's not something I've had any experience with. I think it's one issue trying to build up muscles. Building up muscles can help to a degree, with continence, but they're not going to repair the damage to the nerves. So it's the damage that's caused by, it's the nerve damage that's caused from the cord requiner. It's how you manage that. So I think stimulation like that possibly would have some benefit, but I'm not experienced enough in that. That's an area, I don't know. There is an area in Salisbury Hospital that deals with things like functional electronic stimulation. Stimulation, then worth it, to be honest. I'm just going to quickly go through the list, because I've noticed that there are a few messages popping up. I'll just quickly go through them sort of one by one, if that's all right. So Leanne has put, I still can't understand why, when the cord requiner happened, waited for 10 hours in A&E before I went in the MRI scanner. And by the time I got back to A&E, the surgeon and anaesthetist was waiting to take me to theatre. Could the result have been better? That's a hard one to say. I think if the cord requiner happened and you're having surgery the same day, that's probably one of the better outcomes. I think from what I've heard, often the damage, the sort of more long-term damage, is if you don't get that diagnosis sooner, that it can be left for sort of weeks or months. So a 10-hour wait in A&E is far from ideal, but to come out of the MRI scanner with a surgeon and an anaesthetist waiting for you, on the positive side, I would say that's one of the much better outcomes that I would have come across. I'm just going to go down the list.
What should people do, Damien, if they feel that there might be some negligence with regards to the misdiagnosis and a long period of suffering where it hasn't been diagnosed quite correctly? I mean, what advice would you give around that? Would you think to potentially seek down the route of like legal advice?
I think if you go down the route of trying to seek legal advice, you need to make sure that it is clear that you've got good cause to be able to do that. I think it is, I think a lot of it's about raising awareness of what cord recliner actually is, and you know, highlighting to other healthcare professionals, particularly the red flags, and and um, and not to make you feel that you're just being dismissed with the symptoms that you have got. You know, if you've got, you know, I'm sort of conscious of the fact I don't want to sort of use too much sort of medical jargon, but if you've got neurological changes, which are nerve changes, that needs quite prompt attention. Lots of people might get sciatica, stuff like that, and that can come and go. But it's making that differentiation between, you know, something like sciatica and cord recliner, because, you know, both can have an impact, but, you know, the longer term effects of cord recliner can be quite significant. And, you know, and it's the same with spinal cord injury, that we know that the best prognosis is going to be, you know, when somebody gets more immediate attention rather than it being delayed and delayed and delayed. And if you've got changes in your mobility or your bladder and bowel function, then those really are some of the prime red flags that people really need to be trying to get the GP to understand those issues and to make the right referrals. If the GP is just saying, well, you know, we'll, you know, take some painkillers, it might all go away. You know, for some people that might be the case, but I think, you know, once you start losing mobility, bladder and bowel function, then, you know, we know that there's a more pressing need to get that addressed. And if that's us, you know, just saying to you, you know, if you contact us and you're asking for advice and us just saying, you really need to go back to the GP, ask your GP to refer you to a neurologist or a neurosurgeon. Once you've got to that point, then, you know, you're more likely to be speaking to someone that has that understanding of what cord recliner is, and then they can action it much sooner. Saying that, I think there are still delays. I think, you know, partly because of COVID, I've had, you know, incidents where, you know, people have been discharged from their district general hospitals, sent home, but it's through the sort of advice and support of our support network officers and our volunteers, you know, that recognize those symptoms, and, you know, they've been able to step in and just really make sure that, you know, the patient's voice is heard. And if the doctors aren't paying attention, but it's quite clear that there is something that needs addressing, just what the other options are, and, you know, whether that's sort of escalating it through a complaints, you know, procedure or process through the local hospital. We've used that as well in order to make the patient's voice heard. And, you know, from my recent experience, you know, that's worked very well. And, you know, patients have then had the referrals that they've required and the interventions that they've needed. I'm just having a little look down the list. I won't mention names, although it's on the general chat, but try and maintain some and not anonymity. Someone's put, I've been referred back to Stoke Mandeville to discuss a colostomy bag. Could you assist with support here? Yeah, absolutely. My colostomy fact sheet is on the website today. So that's hot off the press. The fact that you've been referred back to Stoke Mandeville to discuss that is fantastic, because they should be able to link in all the services that you would need. You know, the fact sheet pretty much sums up everything that, I say sums up everything you would need to know, but I think it gives you sort of quite a broad perspective of what it actually entails, and hopefully that will just generate, you know, other questions if you needed to, you know, to sort of direct them back towards us. But having a colostomy often used to be seen as a last resort. When I do, you know, teaching about the neurogenic bowel, there's a diagram, and it's called the hierarchy of bowel management needs or something like that. And the colostomy is right at the top. So the idea is you start at the bottom, you go through the different stages until you get to the top. And yeah, I think there's a lot of discussion around suggesting that we should sort of almost turn that pyramid upside down. Not to offer everybody a colostomy, you know, on day one, but at least make people aware that, you know, that is a potential option, along with other things like, you know, transanal irrigation. So I think the important thing is, you know, you go to Stoke Mandeville, they've got the knowledge and expertise there to give you the advice. They can talk to you about it from a neurological point of view. They would also involve the stoma nurses, who would talk to you about the sort of more specific side of what a colostomy entails and the overall management of it. So there's a good support structure built around, you know, somebody that opts for a colostomy or is considering having a colostomy.
Thank you, Damien. Just a quick one. Which website did you say your fact sheet was on?
It's on the Spinal Injuries Association website. I can put a link to it.
Yes, please. Thank you.
Let me just cut that. And
while you're talking about sort of continence products, one of the things I'm not sure why you're all, you know, while we've got so many people here, I just thought I'd mention one of the other services that SIA offer is the SIA Healthcare, and it's actually a service that I use myself, and it's where you can get all your products delivered to your door through SIA Healthcare. So, and it's pretty straightforward to set up. So again, that's all on our website as well. So, you know, if it's something you'd be keen to look at, then make your, you know, like I say, afterwards, make your way to our website to get a bit more information on it.
Damien, firstly, I'd like to thank you for your help last week. Really helpful. And I actually would like you to highlight, you know, about the consultant that we discussed in terms of the issues. And I'm happy to tell people that I've had a problem after being ill for 2 years with my bowels and bloating, etc., etc. And I'm a Stoke Mandeville patient. And had it not been for Damien, who highlighted a specialist who specialises in neuralgic bowels and with spinally injured in the country, all I can say is that this was never talked about at Stoke Mandeville. I've had a consultation the last few days with my consultant, raised the name of the person that Damien had suggested, and has now managed to get them to, you know, make an urgent referral. And it really is on carrying on from what you're saying about colostomy, because all Stoke Mandeville wanted to offer me was a colostomy. One of the things, again, Damien, I think you can say more on, is that colostomies may not necessarily solve your neuralgic bowel problem. So you could end up through having a surgery that is not reversible, because at Stoke Mandeville they do not do colostomies that are reversible. And so I'm going to leave it to you, Damien. But firstly, really, thank you so much for your advice, your information, because that was never ever discussed at Stoke Mandeville. Yet when I had that brought the name up in the discussion, it was, oh yes, we know about this person. So I think, you know, I'd really like to thank you so much for the help you gave me.
You're welcome. You're welcome. And I think, you know, I think that, so to a certain degree, that even in specialist centres, you know, we can't always get it right. But I think, you know, there are experts out there, and you know, the person that Si was alluding to was a chap called Professor Anton Emmanuel, who's a sort of leading light in the management of the neurogenic bowel. You know, most of the time, you know, spinal centres or, you know, other areas of you know, sort of neurologists, they have got that knowledge and expertise, but you know, it can vary. But I think it's a really valid point that, you know, what Zai's making is that you could be offered something and it might not necessarily be the best option for you. So it's worth just, I don't know, I'm just trying to think of a suitable analogy that if you wanted to get some work done on your house, you don't just go to one person and they give you a quote and you go for it. You know, you get 2 or 3 quotes first. And there's no harm in you, you know, asking more than one person, you know, for some advice. You know, if you feel that you're sort of being steered down a route where perhaps it might not necessarily be the best option for you, because certainly from my experience with you know, dealing with people with spinal cord injury and cauda equina, is that often there is more than one option available.
To be fair, Damien, sorry to interrupt, I've actually asked for a colostomy bag because I'm a professional show jumper. So irrigating every day for 2 hours a day, it just doesn't suit my life. So I end up not doing it and getting myself in more trouble and in more pain. So I spoke to my surgeon about it, and he's the guy that's then referred me to Stoke Mandeville. But I have made a note of this guy you've just said, and I'll definitely research him as well.
Okay. So yeah, all I would say is that you know, getting advice about having something like a colostomy, if you've got a neurogenic bowel, it's good to get that advice from someone that has that level of understanding. And you know, I'd be confident that you would get that advice, the right advice, from Stoke Mandeville. I thought today would go very quickly, and the time is running away, and that there are quite a few questions as well.
I was going to say, if Damien, if you want to have a quick look at the questions and see if there's any that you could answer. Now, what I was going to quickly do was just pass back to Alison and Charlie, because I'm aware we spoke a little bit about what your group's doing, but I feel that we didn't touch on some of the stuff that you've been promoting with regards to your own cafes that you've been hosting. You've been doing, I believe, Alison, like women's mornings, and Charlie, you've been doing something similar. So I didn't know if you just wanted to touch on those topics just so people understand what you're offering as well.
Yeah, so since we started our group back in August, we've wanted to bring people of cauda equina together. So we've started afternoon coffee chats. We've got ladies' evenings, and we've got men's chats, and then we've also got one-to-one coffees as well, because we kind of realise that cauda equina is such a debilitating illness, and men sometimes don't want to chat with ladies, and ladies sometimes don't want to chat with men. So we've got that going on, and that's every couple of weeks. Alison, is that
the ladies groups every week, because it's quite popular. The ladies like to come out for a night out, so to speak.
Yeah.
So do you have a particular day? Do you have a particular day that you're doing this?
Heidi and myself run it on a Thursday, so it's usually about 7 o'clock.
Right. Okay.
And
what about?
And the coffee afternoon is every second Wednesday at 1 p.m. And then we have the chaps evening as well. I think that's Thursday, 7 o'clock as well. Is that right, Alison? Is that?
Yeah, I don't do the chats on the men's.
Well, men's chat is really hard to get men to talk. So if there's any chaps out there that want to come and join us, because I think we've only got 5 or 6 at the minute. So chaps, they were finding very difficult to open up, because obviously it's such a debilitating illness, as I said, that chaps are finding it more difficult to talk than ladies.
Are the topics quite varied, or do you tend to find it always goes back to the most famous, the B&B?
When it's chaps, we probably start off with washing machine talk, and then we'll go into football, and then we'll go back to what's really happening, and that's well, I'll just leave that to your imagination. And we kind of go over just about everything, because chaps do want to talk, but we've got that disease called Britishness, that stiff upper lip, that we find it really hard to talk about. So that's what I'm trying to do with men, is to open up and to get us to talk. And if that means football or washing machines or the business side of stuff, then so be it.
I can't emphasize what a difference it does make when you do open up with people and talk.
Yeah, it does.
Like I say, it puts your mind at rest, because you think sometimes you're the only individual
Yeah.
in the world going through it. And when you start talking to other people and you start to realize it's quite a thing that everyone's battling with.
And when you've got a broad jock who's just opening up and talking about everything, well, they're like, well, if he can talk about it, anybody can talk about it, really.
Hi guys, yeah. I would like to say thank you to Charlie. He knows that I've been struggling to actually open up. I'm a stubborn ex-soldier and I don't really like talking about when I'm down, so I shut myself off. But it's been great to have Charlie in the last couple of weeks.
Thanks, Rob.
And I think, you know, that's fantastic. And I think one thing that, you know, not necessarily lockdown has taught us, but I think certainly during lockdown, we've been more reliant on technology as a means to be able to communicate with people. You know, a lot of the advice that we give through the Spinal Injuries Association, it's not necessarily face to face or over the telephone. You can send in an email if you want advice. You know, sometimes just, you know, putting something down in an email can sort of almost anonymize, you know, sort of who you are, but we can still get you the right information as well. One thing I've sort of noticed that there's a bit of a theme, I think, with some of the chats that have been going through, is that the importance of trying to get early intervention, and, you know, perhaps, you know, the lack of understanding, or the fact that there's a lot of room to improve the level of understanding amongst other healthcare professionals. I can't emphasize enough just the importance of those red flags, and I think, you know, that's something that, you know, we can you know, really promote through, you know, SIA's website or the Cordra Equina website. And I think, you know, I've had quite a few referrals from, you know, different people with Cordra Equina from different areas, and I think a lot of that is just being generated through word of mouth, through, you know, Facebook groups like the ones that Alison, Charlie and Heidi run, which is great. I think, you know, creating that awareness and being able to signpost people, you know, to organizations like us, where, you know, we can give advice about some of the, you know, the physical aspects of Cordra Equina, as well as just some of the more you know, emotional sides, or, you know, the financial sides. I don't want to sort of keep harping back to our website, but, you know, we have lots of information on there that's probably going to be very relevant to a lot of people. We also work very closely with Lindsay at Aspire. We also work closely with the Backup Trust as well. It's worth just having a look at those, you know, other two charities as well, to see what they can offer, because we all offer something quite different. So although there's a bit of sort of blurring of what services we do offer, yeah, each one's got their own sort of USP as well. So, you know, it's a matter that not just one charity can provide all the advice and support. You know, we work collaboratively with the others. And, you know, if it was something like, you know, benefits advice, Aspire are the people to go to. So I think, you know, we all recognize, you know, what each charity can offer, and, you know, we would signpost people to, you know, the other charities as well. You know, the Spinal Injuries Association, just, you know, focusing on that last word, association, you know, we do have trusted partners as well, and that's, you know, trusted partners in the financial side, the legal side, and also care. So, you know, it is worth just having a look at the website. If you to try and find who our trusted partners are, if you have a look at your support network officer part of the page, it gives you a little drop down box. So, you know, you sort of click on where you live geographically, it tell you who your support network officer is, and it'll pop up some of our trusted partners for your particular region as well. So there is lots of support out there. It's just you know, knowing how to tap into it. You know, word of mouth is brilliant. This is by far the biggest cafe that I've run since we started in this with SIA. Often we have about 6 people thereabouts, which is, you know, which is great as well. Last week had 18, so I thought, crikey, you know, that's 3 times as many as we normally have. I think at a rough count, we've got about 75 today, which is amazing. So I think, you know, this is definitely something that we'd be looking to run again. And, you know, we can, you know, run sessions like this. You know, I'd like to think that, you know, within the scope of my role, that, you know, I can, you know, tap into, you know, the Facebook group as well. You know, if you wanted us to come and talk on your groups, we could do that as well. So we've got sort of more conduits as far as, you know, being able to, you know, disseminate, you know, the advice and the support that, you know, we can all offer. I'm just having a quick look down to this. My heart has sunk, but I've just seen 33 new messages, so I'm not sure we're going to get through those.
Just touching on the support network side of the charity, one of the things we were doing, and actually Alison was involved with me in doing it, was we're running community support groups as well, and obviously again, hopefully post lockdown, it's something we'll be looking to do again in various areas to just build up that network. Because again, I just think personally from my experience, having people that you know that are going through similar situation to you in the local area makes a big difference to build those contacts and relationships. I mean, for me personally, I must say that when I first came out of a spinal center after my injury, I really did feel like I was the only person in the world with a spinal injury. And it was only through the role I do now that suddenly I realized how many people within such a small geographical area actually have spinal injuries, and trying to bring each other together just gives you, such good support. And one of the other things, again, while we've got 75 people on here today, I would just mention that if you're not a member with SIA, then again, I'm going to have to say, make your way to the website and register with, and you'll be able to get emails, updates on various things and support, with regards to support. And one of the other things that I found really beneficial to me was the bi-monthly Forward magazine that was sent out. And again, for me, just having that magazine to make me feel part of a community and know that there was other people going through the same situation really helped me in those early stages. So
yeah.
Thanks, Michelle. I've just seen Michelle just held that up for us. Thank you.
Sorry, Damien, I've talked over you. I was just going to say that going on what you were saying, Martin, when I registered, I've been waiting to be sent to the spinal unit for the last 8-9 months. I was basically told that my L4, L5 disc come out at right angle, and they should heal within 6 weeks. Never did, and all I've been given is pain management. Since I registered with SIA, Debbie did me a referral, and I sent that to my GP. I've finally been referred to Pinderfield, which is something I've been trying to get for months, especially because I've got Crohn's disease as well. So,
and that's fantastic. I think it shouldn't have to be this way, but unfortunately, it can be a bit of a battle to try and get that referral through. But sometimes, just a bit of perseverance will help, and we can support you with that by just talking through perhaps what your symptoms are, and just giving you a bit of support to try and get that referral if it's appropriate to get that actioned. I'm just having a quick look through the list. So I think a lot of the questions that have been posted, other people answering other questions or sharing their experiences as well, which has been great. So, you know, there are some links on there. What we can do as well, Alison, Charlie, Heidi, if you're happy, just through our social media, is just put your Facebook on our social media, just to get, you know, that message out as well.
That'd be great, Damien. Thank you.
Thank you.
Okay.
Before we go, Damien, I just wanted to ask whoever's running the show, maybe next week or in the next couple of weeks, that we could have a discussion on the changes that the government want to make. One, giving the Secretary of State powers basically to run the health service, etc., which actually is historic, because that used to be the case, and it was actually beneficial to the spinal units and spinal injuries. And so, and then look at, you know, some other things around that, and how it could be beneficial.
I know we've got a list of topics lined up, certainly I think through to about the end of March. But, you know, the whole idea of running these cafes is that they're not for us, you know, to decide, you know, what we should be talking about. You know, it's to give you the opportunity to tell us what you'd like us to talk about or who you'd like us to bring in. Because, you know, we do have cafes that are just like a regular cafe, just come in, have a bit of a chat about, I don't know, something that's sort of topical or, you know, pertinent to you. But I think having a theme, you know, just makes it a lot more productive. And so, yeah, I'm very much, you know, the opinion that, you know, we want to make these cafes relevant to yourselves. You know, what do you want us to talk to you about? How do you want us to run them? So, yeah, any ideas? And, you know, I think last week we were talking about aging with spinal cord injury. That was a popular one, something we're going to repeat, but make it a bit more specific to, you know, preparation for aging well with spinal cord injury, cauda equina. So, yeah, you know, they're all cafes. You know, we will, you know, host them and, you know, make them available for you to discuss, you know, what you'd like to them to be. So I'm conscious of the fact we've gone past the hour. I'd just like to say thank you very, very much to everybody that's attended today. It's completely blown my mind, really, to see so many people here. It's been fantastic. So I think,
thank you, everyone.
Thank you.
I think cauda equina probably wins the prize as far as the most people here. So, you know, clearly there's a need for it and a demand for it. And I'm happy to, you know, try and get something in the diary again sooner rather than later.
Yeah, I think that'd be really great to run something again, like for cauda equina. And and as Damien said, if you've got any suggestions of topics, then please get them over to myself so we can try and make it, like I say, around what, you know, what it is that you want to talk about. And also thank you to all of our guests for coming in and talking today. So thank you, guys.
Thank you. It's been a pleasure.
Thank you, Damien.
Loved it.
Thank you very much.
Right. Take care, everybody. Thank you very much.
And so we'll get the links out for the Facebook group out on our social media, I think, and just to sort of, you know, signpost people to them. But otherwise, if you've got queries, you know, just come back to us.
Damien.
Hello, John.
Hi, Damien. I posted a question for last week, which was about pain management. And of course, we were a small group last week, and now we're 75.
Yes.
Suggestion, Backup, who I attend twice a month, they divide the groups into different areas. I'm in the walkers group on Backup, but there are 6 different groups. If we continue to have this great audience of 75, would it help to break out into different areas of the cafe?
Oh, I'm not sure that's an answer that I can give, but I think, you know, because I am new to SIA, you know, I've seen some cafes where we might have only had 1 or 2 people there. So I think, you know, we're open to, you know, meet the demand of what people want. But yeah, I think that's a question that I need to ask somebody else, I think.
Oh, Damien, I'll take that one very quickly. Yes, we can look at doing that. You know, these cafes are going to be ever evolving, and we want to work with the community, the spinal community as a whole, to develop these things. So any of your feedback or any of the different ways that you've seen that work or don't work, please do let us know. Drop it in the comments, email one of the SIA staff, and we'll work at developing these cafes to make sure it's a good user experience for everyone coming in. If that means us having breakout rooms, it's definitely something we can look at progressing into.
Okay, thank you, Gary. Thank you.
Thanks,
no
Gary.
problem.
Thank you, John.
So, thank you again, Alison. Thank you, Charlie.
Gary.
Thank you, Dan.
Bye.
Thank you,
Gary.
Lindsay.
Yes.
Thank you.
I'm formally,
everybody.
because I can't email or whatever, I'm formally requesting that we do a thing on the powers that the government are pushing to the Secretary of State, and how that will affect the spinal injuries unit. And I'd also like during that we actually look at how that had been in the past and how it had benefited the Spinal Injuries Association.
Sure, we can. I'll put that suggestion to Sophie, who runs our, who's currently running our agenda, and we'll build a host and guest speakers around that. It's probably not going to be for a while because we do have quite a packed agenda going forward. But yeah, we can definitely look into that. Thanks, thanks.
This is happening very soon.
Okay, we obviously we've already got an agenda. We need to be able to fit that in. But yeah, that's great suggestion. I'll pass that on.
Okay, thank you.
No problem. Brilliant. And for those who are left, don't forget we are recruiting in 4 regions across the Northwest, West Midlands, East Midlands, and Northern Ireland. So if there is anybody here who was interested in the job working for SIA as a support network officer, Dan Burns very kindly put the link into the chat where you'll be able to find it and get more information on working for SIA, supporting people with spinal cord injuries. Yeah, thank you. There is a hand up. I don't know if that's a wave or a.
Is that Brenda?